morning again.
Morning. The Finance Committee of the Cook County Health System called the meeting to order. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require call votes for all action items. Streamline, we've combined the action items into one combined motion so that only one roll call vote will be needed during the meeting. Of course, that can always change and could have more than one, but the intention is to have one. Will the secretary please call the roll?
Director Deere,
Deere's here.
Director Harrington,
Here.
Director Robinson,
Present.
Director Story,
Present.
and Chair Ryder.
Writer's here.
You have a quorum.
And as was just acknowledged by the roll call, we have a new member of the committee, Director Sam Robinson. So welcome, Sam, to the Finance Committee.
Thank you. Glad to be here.
It's rip roaring fun, so buckle up. The the next regular meeting of the Finance Committee is scheduled for Thursday, May 18th at 2023. May 18th, 2023 at 9 a.m. May 18th also happens to be my daughter's birthday. For those interested, it's a big date for me, Finance Committee and a 14-year-old. So, Debbie, is there any public testimony?
Yes, we have 4 speakers who registered to give virtual oral testimony, and we received 1 written testimony from Deborah Turner. So the first speaker who is connected with us is Barbara O'Brien. And a reminder to the speakers, you have 3 minutes to present your testimony, and I'll give you a quick reminder when you have 30 seconds left and then when your time has expired. Ms. O'Brien, are you connected?
Yes, I am here.
Excellent, thank you.
Okay. Yeah, you bet. So good morning, members of the Finance Committee. My name is Barb O'Brien, and I'm a registered nurse who works within the Integrated Care affiliate of Cook County Health. It is important for you to note that Integrated Care affiliate includes our managed care organization, County Care, a substantial source of revenue for the healthcare system. As members of the Finance Committee, you know that from January of 2022 to June of 2022, the membership enrollment has been consistently over 420,000 per month, with an average enrolled monthly membership of 390,000. You are also aware that the revenue from County Care alone in fiscal year 2022 was $2.6 billion, more than double the amount of revenue generated from all other sources combined. As a nurse working in Integrated Care, the highest revenue generating affiliate of Cook County Health, I find it oddly ironic to have witnessed and to be a part of the disintegration of Integrated Care. Today, my colleagues will tell you that on April 14th of this year, we were noticed that we will return to patient care duties in the field, in field sites that are not regulated by the county government. They will also share that on April 14th, the notice stated that RNs will be subjected to discipline if they do not return to quote unquote normal operations. They will tell you that we have been demanding negotiations of the impact of this from our management and the County Bureau of Human Resources since July of 2021. They will alert you to the immediate threat of wasting county resources and the total disregard for the safety of the employees of County Care. And I agree with and I stand with each of them. But I want to introduce new information for you all to consider as sitting board members of this Finance Committee. In addition to the threat of discipline from their employer, who has an obligation to keep its employees safe, the lack of fiscal responsibility, and management's ongoing refusal to fulfill their legal obligation of discussing the impact of working conditions, Unilaterally decreasing integrated care RN wages in the budget appropriation for fiscal year 2023 creates an existential threat to nurses and the patients that they serve. To have approved and published a budget that does not match up to the terms of our CBA is a gross misrepresentation of taxpayer dollars. The RNs in integrated care have been and will continue to provide stellar care to our patients. We have not become the quote unquote largest Medicaid managed care plan in Cook County by accident.
30 seconds remaining.
I gotcha. RNs in integrated care believe in what they do and proudly serve our patients. Our patients deserve care from RNs who are able to focus on the patient and their needs, not the threat of discipline, not the lack of resources, not unsafe working conditions, or the threat of wage reduction as proposed by fiscal year 2023 bill appropriation. Month after month, year after year, we boast of our enrollment, but we seem to have lost sight of what is really important: quality, safe care for our patients. Members of the Finance Committee, our working conditions aren't new, as some have suggested. They are changing. They are adapting. County, as an employer, has a duty to bargain in good faith. I am not requesting that in-person duties be delayed. I am requesting that county negotiate the impact of their changes to RN working conditions under labor law. The discussion itself is not the remedy. Thank you.
Thank you. Chair Ryder, the next speaker is Brenda Langford. Brenda, are you there?
Yes, ma'am, I'm here. Thank you. Good morning,
Thank you.
everyone. My name is Brenda Langford. I am an RN working in the non-waiver health plan division of integrated care. I have been an RN for 28 years and have worked for Cook County for 25 years. For the past year, I've been working remotely to promote the safety of the patients and my safety as well, due to the devastating effects of the pandemic. The work that I perform is vital to the patients that I serve, and the work I perform brings in resources that the county needs to continue to operate. It is due in part to our labor that county care has been significantly exceeding expectations with respect to net revenues, which overall helps Cook County health system. Last week on April 14th, NNOC RNs were noticed. On May 1st, integrated care RNs will have to return to in-person duties or we will be subjected to discipline. Management, as of now, is refusing to meet and discuss the impacts of our working conditions as they are legally obligated to do so. To be clear, integrated care RNs are not making unreasonable requests, with the most major request concerning a development of safety plan and protocols as we return to the field. Cook County has a duty and obligation to keep its employees safe. It is illogical that integrated care RNs have no safety guides or protocols to reference when we are in the field or out of the controlled hospital clinic setting. Some of the neighborhoods we're visiting are in economic disadvantages and are plagued by violence. Those patients matter, and we deserve a safe plan when we are approaching those patients to assist them with their services. There are productivity and financial reimbursement concerns regarding our field assignments. Our assignments are not necessarily clear, logical, or efficient. An example of one of these concerns are the travel zones for each RN, which should be based on a geographical location of patient population. If our travel zones are not assigned based on location, we waste a substantial number of resources and time spent traveling to various patients. This has been the potential of drastically decreasing our productivity. Fewer patients seen may minimize the financial reimbursement levels of Cook County Health. On my current assigned panel of patients, I have members that live as far as an hour and a half away from where I am. I will be spending 3 hours on travel time alone. This would greatly decrease the number of productive hours that I would be able to complete. Our current productivity standards for the non-waiver health plan side is to be actively in our electronic system for a minimum of 6 hours a day. That still permits us time to outreach providers and state organizations to coordinate resources for our members. We are also held to standards of outreaching 5 to 6 unique members per day. If Cook County Health does not rezone our patient panels, there's no way I'd be able to continue that level of productivity if I'm spending a minimum of 3 hours in travel for one patient. During that travel time, I would not be able to multitask and complete follow-up calls or coordinate resources for that member to develop care plans or complete any other important documentation that is needed to ensure financial reimbursements are received. Patient resources do differ from each community, and it's important for our nurse care coordinators to be familiar with those resources to provide the best health outcomes for our patient populations and utilization of management resources. The benefit of ensuring our patient populations connected to correct resources in the right places and at the right time is to promote positive health outcomes, prevent hospital readmissions, and the overburdening emergency rooms due to a lack of access to care and health resources. The
Time has
RNs of integrated
expired.
care
Excuse me,
are
ma'am.
requesting. Thank you so much.
I'm sorry. Your time has expired.
Thank you.
The next speaker is Maribel Quinones.
Good morning. My name is
morning.
Maribel Quinones. I am a community-based nurse care coordinator and NNOC nurse representative in the Integrated Care Department. The Integrated Care nurses have been a valuable asset to the Cook County Health System by providing care coordination to county care members. During the COVID pandemic emergency, we assisted our members with obtaining life-saving medical services, emotional support during a very scary and uncertain time, resources in the community, and provided COVID safety education. Many of our nurses worked in the hospital units, Cermak jail, and in a makeshift shelter, putting themselves in harm's way to save lives while saving the Cook County healthcare system thousands of dollars by not utilizing agency nurses. During the last 3 years, we were asked by management to be flexible and assist in any way possible to get through this emergency. We cooperated and discovered many issues that we wanted to address with management to provide safe, cost-effective care. We have been requesting meetings with management to discuss these issues since July 2021, with no resolution up to now. We received a letter from management last week that the COVID pandemic emergency will be over and we are to return to normal operations. Normal operations at this time mean unassigned geographical zones, which can be costly due to travel throughout Cook County to meet with clients, PPE equipment, which will increase the cost of a face-to-face visit versus a video telephone visit, and potentially loss of staff due to unsatisfactory job expectations, as seen throughout the nation and has cost hundreds of thousands of dollars due to recruitment and retention costs. We are asking for management to meet with the NNOC nurses in good faith to discuss our issues and work on providing quality, cost-efficient care in a safe manner to our patients. Thank you.
Thank you for your testimony. The next speaker is Dora Edwards. Ms. Edwards, are you present? Chair Ryder, I don't believe that Ms. Edwards is present. So as I mentioned earlier, we did get a written testimony from Deborah Turner that has been emailed to you, and it has been posted to the website.
All right, thanks. Thank you, Debbie, and we'll all have the opportunity then to review that testimony. So that concludes all of our testimony, Debbie.
That is correct.
Right. We're gonna move to our first items on the agenda, which is our next item is the Finance Committee meeting minutes. The March 23rd, 2023 Finance Committee meeting minutes were approved by the board at the March meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Are there any corrections that need to be made to the minutes? Does anyone have any corrections that need to be made to the minutes? Hearing none, we're going to hold the approval of the Finance Committee meeting minutes, part of the combined motion, which will be considered later in the meeting. Moving along, next item is the contract and procurement items. There is, I believe, Charles Jones, our Chief Procurement Officer, and verify this. This is a record amount that we'll be considering today. Is that correct, Charles?
Yes, sir. Good morning, Charles Jones, Chief Procurement Officer. Yes, it's 47. I believe it's the highest, at least in my tenure, 3 shy of 50 share rider. So, and before you go with that, I'd like to say that of the 47, 45 required responsive letters from the Office of Contract Compliance, we have 32 back with 13 outstanding. Thank you.
I'm also going to point out that the reason why we have so many is there are a lot, or first 22 are going through the Cook County Department of Public Health, and I believe Dr. Hasbrook, who is our Chief Operating Officer for CDPH, is CCH, is going to walk us through numbers 1 through 22. Dr. Hasbrook, are you there?
Yes, I am.
All right.
Good morning and thank you. Yes, so good morning to the directors. Good morning to folks tuning in. So yes, we have 22, and I'm going to summarize them because they're pretty much from a very similar process. They are all grant funded. So these are all grantees or sub-grantees. The funding source is predominantly CDC, Centers for Disease Control Health Equity Grant, which is really focused on COVID recovery and resiliency, addressing those populations hardest hit, and to help in recovery efforts and going forward. They have all been RFP'd or request for proposals and competed. These are all actually continuing programs that are in the field that have been going on already. So they're in 3 buckets. The first bucket of the first 12 are for extension and increase. These result from a negotiation with CDC for a no-cost extension for 12 months. So to extend them from this May to next May of 2024. And so that's the first bucket. The second bucket is of 9. Those are not to increase the period, or sorry, to extend the period, which already goes from October 22 to August of 24. They are to increase the dollar amounts, again, directed at health disparities related to COVID. And then the last one is a grant funded from HUD, Housing and Urban Development, and that is to extend our work that we do in lead contamination protection, primarily houses and primarily paint. And it's to increase the scope of work for the lead inspectors from inspecting on the front end those at-risk houses to coming back after the houses have been repaired, remediated, and clear to go to do what we call post-lead inspection clearance. That is to give them the green light for the families to move in. So again, the first 21 are all directed towards things around housing, community health workers, training, technical assistance, pediatric training, services for the disabled, older adults, and worker protection program, again, under this large grant funded program called Building Healthier Communities. And that summarizes these 22. So happy to take any questions.
Any questions? All right. Debbie, are we scrolling through all these? Is that what's happening?
Yeah, because we used the cover sheet to kind of go with the briefing. I'm now moving to request number 23.
Okay.
Good morning, directors. Aaron Glenner, Chief Administrative Officer with the Health Plan. One item for you today, which relates to our provider directory. This is the result of an RFP with a goal of making our provider directory much more user-friendly for the member experience, as well as improving some of the data quality in terms of the provider rosters that we receive, and then which flow through to the provider directory. Happy to answer any questions.
Are there any questions for Aaron on request number 23? If not, we will move on to request number 24, which is going to be presented by Dr. Fegan.
Good morning, directors. So this is actually a product of our digital age. We have all digital imaging of our radiologic studies, and we've exhausted the memory that we need to store that. So this is to cover additional memory so that we can continue maintaining our vast electronic imaging for years to come.
All right. Any questions for Dr. Fegan?
All right, thank you.
All right, moving on. Requests number 25 and 26 for equity and inclusion are going to be presented by, I believe this is Dr. Nowinski Konchak. Did I say that right?
Yes, thank you. Good morning, directors. I'm Julie Nowinski, contract with the Center for Health Equity and Innovation. These next two contracts are both related to a Department of Justice grant, the Comprehensive Opioid Stimulant and Substance Abuse Site-Based Program. The first is with Family Guidance Center to provide a navigator for the Cook County Recovery Home Community Capacity Recovery Home Project, which coordinates access to recovery housing for our patients and others throughout the county. And the second is for Lighthouse Institute of Chestnut Health Systems to be the evaluator for this grant, and they are doing qualitative interviews on the Recovery Home Project, and both are grant funded. Happy to answer any questions.
Any questions?
I just have a quick question on the amount. On 25, the total is, the grant fund is $160,000 for the navigator.
Correct.
And the evaluation, excuse me?
That's correct. That's for 3 years of a navigator service.
And the evaluation is 138?
That's also correct. That's for 3 staff at Chestnut for part of their time over 3 years.
I'm not understanding this. The navigators are individuals who are working to provide services to clients. And the evaluators are evaluating the effectiveness of the navigators of the program.
Sure. I hope I can answer your question. So the navigator, the contract for the navigator will pay for a full-time navigator. This is a certified alcohol and drug counselor, and in the past year, Family Guidance has been providing this role in kind in a part-time fashion. They will now be funding a full-time position for the next 3 years for the life of the grant. And so that is what this contract is. And then for Chestnut, that is right. So that is for them to do the evaluation over 3 years of not just the navigator themselves, but the whole process. So for example, they're going to all the recovery homes, they're interviewing clients, they're interviewing recovery homes, they're interviewing hospitals and jails. These are all PhD researchers and evaluators, and that are implementing this for us as a part of the requirement for the grants. Did that answer the question?
Yes, just very quickly, I was looking at the total dollars for the navigators, and then when you made the $138,000, I made the assumption erroneously that the $138,000 was for the navigators at $160,000. But the evaluators are evaluating, as you clearly stated, the entire program.
Correct.
Thank you.
Thank you.
All right. Any other questions? That takes us then to request number 27.
Well, good morning, directors. This is Pam Casera, Chief Financial Officer. We have one item before you today for revenue cycle. This contract is with Paymentus. Paymentus is a patient financial responsibility tool that we use for payments at the point of access or online. This allows us to pay for medication outpatient pharmacy, pay for copays at the time of registration, et cetera. And this tool has been utilized more than originally thought. It is a 5-year contract, and this request is to increase the contract amount in an amount not to exceed $300,000 is needed for the remainder of the contract period through June 30, 2025. Any questions?
All right. Not hearing any questions. Thanks, Pam. Next up is request number 28, Health Information Systems. This is one that is a correction to a previously approved item, and Charles is going to briefly review with us.
Yes, good morning again. So this was one that was done on a mission on behalf of my department that was brought to you last month. It is a contract with that was brought in the name of Insight Global LLC. But as we dug a little deeper with the different divisions we have, the vendors Insight Public Sector, all else of the contract remains the same. So we conferred with the General Counsel and the Board Secretary and found that it was best to bring this back to you for correction. So again, this was approved by you last March 31st and pending completion of review by the contract compliance. And it's been brought back for approval to amend the request to reflect the correct vendor name as indicated. Thank you.
Thanks, Charles. The next one, I believe this is the next three are under Human Resources. Valerie Amos, our Chief Human Resources Officer, request number 29 through 31.
Good morning, Chairman and the board. This is Valerie Amos, Chief Human Resources Officer. The contract before you is for Deloitte Consulting LLP. Deloitte has been with us for the previous 6 months, and this is an opportunity for us to amend, extend, and increase the contract for an additional 6 months. So Deloitte has been providing recruiting capacity. As you know, the CCH organization is working towards accelerating hiring. And so there have been a number of recruiters that have been brought in by Deloitte. In addition to that, the HR optimization portion of our work has also been supported by Deloitte, i.e. compensation, job architecture, working towards assisting us with revamping orientation to onboard individuals accordingly, as well as designing some learning platforms with our training and development team for retention purposes. Are there any questions? The next contract?
I have a question.
Yes, Director Story.
This might be more for Charles, a procedure question.
Sure.
Charles, with respect to a vendor who's already under contract with the county and they have been approved by compliance, what is the process for verifying that, first of all, they approved by compliance? MWBE, how do we verify that they're honoring their commitment to MWBE throughout the process, throughout the engagement with the county?
So thank you. Good morning again, Charles Jones, Chief Procurement Officer. So first of all, if the county has a contract that is totally separate from ours, our contract is done on behalf of the health system and approved by you, the Board of Directors. So we have our own contract. We have our own goals with the Office of Contract Compliance. The vendor send affidavits and attestment for that participation. And then they self-report to the Office of Contract Compliance. And if there's any issues with them not being compliant, then the Office of Contract Compliance would let us know.
So this is the contractor does a self-monitoring.
Well, they report into the Department of Contract Compliance system that they have, and it's monitored from there. It's self-reporting, but the compliance officer checks in on it. Our compliance officer is normally on this call if you'd like for the Office of Contract Compliance to speak to that.
And to highlight or to make sure that we have clarity, the Office of Contract Compliance, Charles, that's not under the health system. That's under the Office of the President, right?
Yes, that is under the Office of the President. We do have a compliance officer that we fund for that endeavor, but yes, it's all under the Office of Contract Compliance with the President's office. I believe our compliance officer is on again. If I do not wish to speak on behalf of them, if you would like for them to clarify anything, but Ms. Miller.
I appreciate that, Charles. You're absolutely right. If they would be so kind as just to expound on how they, throughout the process, I mean, this is a 6-month engagement, well, for 6 years or whatever. How do they do their work to verify that we're not engaged in a bait and switch?
Okay. Ms. Edwards, are you on this morning? Okay. All right. Well, generally, they have participation with the meeting, either Ms. Malia Edwards or Ms. Janetta Carradine, the Deputy Director. So we'll reach out to you separate, with this, because again, I receive information back from them and we work hand in hand together on making sure everything's compliant. But my department does not have authority when it comes to total responsiveness for that. So again, yes.
Charles, how about this? This would be a good topic. How about we reach out to the Office of the President, whoever our contact is for that, and ask them to have someone from the from compliance do a presentation with us about this.
Absolutely. Yes, we can arrange that.
Great.
Thank you.
Charles, if you can include in that, because I think I understand Director Story's issue to some degree. If the question once we find out everything, it's going to boil down to if the organization is not compliant, what happens?
Yeah,
that is a follow-up question. Yes, that's true.
Right. In normal circumstances, they will advise the vendor of that non-compliance and give them opportunities to become compliant. And if they're not, then they will send my department a letter of assessment of a penalty to that vendor subject up to termination of the contract.
Because one of the things that happens is, and I'm quite sure everyone on this call has heard this, we can't find any. That's the normal statement that will be given by an organization when they do not meet their MBE numbers, which I have found it to be not so truthful at times. It's a question of where you're looking. And I think if we're going to do it, we should do it properly.
Right. Understood, but that's totally separate. In the beginning, if there is a goal, and we get contract specific goals for all contracts, if there's a goal and the department, the utilizing department provides participation, then there's an affidavit and there's a utilization plan that's certified and notarized that they have to stay compliant with.
And one of the things that I think we should, before we get too deep into this is managing that process is not our function. There's functions that are held specifically under the Office of the President, and I don't want us to get into what drilling too deep into this without them being able to explain their process, because we don't own the process. We're just recipient of the results of the process. We get direction from them on what to do. The health system does not control this.
Mr. Chairman, I look forward to that presentation then.
Okay. And the last thing I'd say is that they do have a diversity management system. It's called B2G Now, that again, the vendor self-report, and if they're not compliant, penalties are issued. Thank you.
Okay, great conversation. Next. So the contract before you is for Katina Solutions. They are formerly known as Advanced Resources. They are also a staffing agency that have brought in additional resources into the CCH, departments within HR. And so really the support that's needed here, they have formally provided some recruiters, but currently we have agency staff from this company that are there to support our back end operations. In the HR operations team, we have a number of files that we are collating and hopefully will send out for proper imaging. And so this is an opportunity for us to ensure that there's a cleanup there, in addition to them providing additional HR assistance to support recruitment efforts as well. Those assistants assist with onboarding new hires, badging, additional new hires, fingerprinting them, as well as conducting those pre-employment checks. So this company has also been a lifesaver for us. This is an additional amount to amend, increase, and extend. Any additional questions? Next, please. Kirby Bates Associates. Kirby Bates Associate is also a firm that supports staffing, and they have provided interim leadership from their company. This is an opportunity for us to amend, increase, and extend as well. We have now moved from one interim leadership vacancy that needed to be supported to about 6 of those. And so this is a projected amount based on the individuals that have been brought in or will be brought in as a result of hopefully our approval today, so that we can really have those leadership vacancies supported as we continue the recruitment efforts. So bridging the gap until some of those positions are being filled. And so there are about 6 vacancies that we'd like to have interim leaders in for a defined assignment so that they can support and bridge the gap until we fill those positions. Thank you.
Thank you. Our next item is request number 32 through 36, which are going to be presented by Dr. Bina Peters, our Chief Nursing Executive.
Good morning, Chair, Ryder, and the Board of Directors. This request is to expand the spending capability up to $70 million for VIA Workforce Solution. The VIA Workforce Solution support agency staff, both RN and their nursing support positions across the system. And the previously approved funds were used to not only provide inpatient or regular care, but also we use them for support the vaccination, the COVID-related activities. So the agency staff will be used to cover the vacancies, existing vacancies, while we are working with HR and the whole team to expedite the hiring to provide safe quality care. With that, I'm happy to take any.
All right. Dr. Peters, this is consistent with your budget plan for this fiscal year, this spend, or should I ask Pam that question?
I think it's with the Pam, and also, Pam, will be the right, but we do have a budgeted vacancies in the nursing approved budget to fill all these positions.
I'm sorry, Director Story, what was the question?
I was just asking Pam that the request that Dr. Peters has before the Board of Directors, is it consistent with the budget that she had put forth for fiscal year 23? The timing of this, is it in sync with her budget plan? That's all.
So as you know, and as Bina indicated, we will need to do transfers to cover these costs from unfilled vacancies, but the vacancies are budgeted.
So, and I believe this is the one. So when we looking at this, it's also, I believe we're doing better over year to year on adjusting this contract down. And I think it's important that, you know, we continue to make progress on this. And it appears, Bina, am I heading down the right track on this?
Yes, you are, Chair Ryder. We are, having a projected to decrease the total agency cost to 25% by expediting the hiring as well as, looking at the retention strategy.
Yeah, I mean, maintaining those vacancies as we start the budget's important because we are continuing to turn that number around in terms of getting ahead and filling vacancies. But at the same time, we're still going to have this legacy of spend of being able that we're trying to retire year to year. Converting this to full-time positions.
Correct, Chair Ryder. That is our strategy and the goals.
Any other questions? All right. Pina, why don't you keep
I'll keep the next one. Debbie, can you move to the next slide? This request is a one-time purchase of 12 ICU beds and 3 wheelchairs, big wheelchairs and the stretchers to support operation of the Stroger Hospital. We are in the process of replacing these equipments as a strategy to provide safe quality care. And also this request include replacement of the wheelchairs at Cermak Health System. Any questions? This item also is one-time purchase request under the lease line to replace the neonatal ICU equipments, which includes Panda warmers. Those are the required equipments to provide care to infants, as well as treatments and needed to phototherapy machines and the warmers support the care. Also, this is the replacement project for equipments at Stroger. Next one, please. We are also in the process of replacing bedside equipments, which is bedside stands, overhead tables, and recliners, and within the Stroger Hospital patient rooms. This also is part of a replacement plan to replace the old equipments to modern equipments. The next one, please. This is a Spyglass is a request to the capability of our endoscopic procedures, and this particular machines will expand our capability to do more cost-effective as well as effective care to all the endo procedures to improve the safety and the quality of patient care outcomes. This is a one-time purchase. The next one. Last one for nursing. So with that, I'm happy to take any questions.
All right.
Thank you.
Thank you, Bina. We're getting close to the home stretch here. Oh, we are the home stretch. All right. Next, request number 37 through 47 are going to be presented by Craig Williams, our interim chief administrative officer, operations development. Craig, you're up.
Thank you so much. This is Craig Williams, interim CAO. The first one is for GE Precision Healthcare. This is an increased contract totaling $6.5 million. The current contract expires 11/30 of 23, and we're just adding funding to cover the existing services being provided. We outsource our clinical biomedical engineering to GE, and this contract was originally obtained through an RFP. The next one is for Metropolitan One, which provides valet parking services. And this amendment is for additional funds to cover increase in services for FY23 totaling $174,504. This contract expires 12/31/23, and we'll be doing an RFP prior to that expiration. The additional services are included here are valet services at Stroger, which were not part of the original contract, as well as some recent salary increases for the valets. The next one is Bessie Medical, which is our specialty pharmacy distributor. Contract amendment for 1 year with no increase of funds to continue purchasing of specialty medications. We're requesting to revise the contract period from 1/1/23 to 12/31/23. And Bessie Medical is a specialty pharmacy distributor for which we currently use to procure Eylea. And Eylea is a specialty medication used by ophthalmology to treat wet age-related macular degeneration. Interstate Electronics, it's a contract amendment for 1 year with no increase of funds to continue maintenance support of Stroger's overhead paging and nurse call systems. This would extend the contract from 5/1/23 through 4/30/24. Vitalant is an extended increased contract for an additional $3.83 million. It's a 1 year extension of 7/1/23 through 6/30/24. And we're going to be completing an RFP before the additional expiration. And Vitalant provides blood supply and medical director oversight of the blood bank at both Stroger and Providence. Imperial Parking is a contract amendment for 1 year with funds totaling $2,641,647. It's a 12-month extension from 5/1/23 through 4/30/24. Imperial provides our garage management services at both Stroger and Providence. And we'll be working on an RFP before the expiration of this contract. Abbott Labs is an extended increased contract for $1,081,925. It's a 1 year extension from 4/1/23 to 3/31/24. And this agreement covers analyzers and reagents for HIV and hepatitis testing. We originally sourced this through a GPO. And before the end of this contract, we'll be upgrading our equipment, which is why we're only requesting the 1 year extension. Priority Health DBA CuraScript, it's an extended increased contract for 1 year for a total of $250,000. And this is to continue purchasing Nexplanon, which is an internal uterine device, an IUD. And Priority Health is the sole distributor of this particular IUD, which is why it's a sole source. Illinois Department of Public Health has extended increased contract for $225,000. It's a 1 year extension from 6/23 to 5/31/24. And they provide newborn screening tests, which are required by the state. Halliburton and Root is amended, extend, and increased contract for $149,000. Contract period would be from 12/1/22 to 11/30/23. And this vendor is providing architectural and engineering services related to the ambulance bay redesign at Providence. And we're doing this project through CIP. And the last one I have is tenant sales and service. It's reinstating a GPO contract for 1 year at $169,000. It would begin on 5/1/23 and expire 4/30/24. And they provide maintenance and repair services for our EBS equipments. I'm happy to answer any questions you have on any of those. I know I read through them fast, but I know wanted to get us on time.
I'm sorry, I was on mute. Any questions for Craig? And Charles, if not, any other wrap up on any of those items?
No, sir.
All right, then we are going to move forward. We will be holding those items for the combined motion later in the meeting. Next will be the MBEWB report, which Charles will be presenting.
Thank you, Chair Ryder. What you have before you, if you look over to the 4-2 right columns, is February 24th, 2023, the board, February board, where we brought before you 14 contracts in the amount of $24.56 million. Of that, 13 of those contracts actually had 0 goals, which simply means, when we went to the Office of Contract Compliance for a contract specific goal, and they checked the directory, there was no vendor certified there. So there was 0 goal. Only one contract had a goal for $6.5 million. And you see that one was a subcontractor for $2.275 million in the 35%, full 35% goal that we generally would have. Looking at the far right, year to date, 14 contracts and a little bit over 78 million had goals. 3 of those are prime with 16.684 million, 21%. 8 of those subcontractors, 20.4 million, 26%. So 11 vendors total, a little bit over 27.1 million and approximately 47% there. There was 3 vendors that had waivers and $2.65 million. And with 4 waivers, so what happens there is back to what Director Robinson had asked. In this area, we had a contract specific goal there. The vendor said there was no one that can participate with it. So the Office of Contract Compliance took them to doing due diligence. And after the due diligence, took it to a waiver committee, and a waiver committee approved that it was okay to find them responsive. Next slide, please. And there we have a visual with the bar chart for 35% for February and 47% year to date. Any questions?
Any questions for Charles?
All right, thank you.
All right, you want to? We're now
So here
on
we
to
have, yes, we have one emergency purchase present before you with the Board of Trustees of the University of Illinois on behalf of its University of Illinois Hospital and Health Science. 12-month contract, $309,000 on behalf of the Department of Neurology to support neurology EEG monitoring services at Providence.
meeting their key performance indicators. They had a record cash month in February of all record time high of 82 million. And spoiler alert, I hear they're on track for another record month this month. Next slide. Denials, again, everything trending in the right direction, being so highly Medicare, Medicaid. The bottom right corner there, the government denials, we want to see those, next to nothing. In addition, they're meeting the industry benchmark of being less than 2% of cash collections. And then all the middle box in the yellow, all the various reasons for the denials, tracking and trending those and trying to eliminate the underlying root cause. Next slide, Debbie. Our charitable and public program expenditures, just showing our trend over the last few years and as compared to our budget, not only in the traditional charity and uncompensated care, but also the other services we provide for CIRMAC and public health and the community as well, but tracking pretty consistently across all years at around the 400 million mark. Next slide. Our savings initiative. So first quarter through the year, you would expect us to be at 25%. We're a little under that at 16. You can see a few yellow stoplights there. Those revenue cycle items are just slated to start to occur a little bit later this year, but everything else on track, and we anticipate we'll catch that up a little bit later. And then last slide, I believe, is county care. Yes. And as I mentioned, the story here is the graph at the bottom. We budgeted the blue bars for redetermination to begin at the beginning of the year and slowly go down. And of course, it has not and will not until about mid-year. And so those red bars should be at that higher amount till about mid-year. And they came in, as I said, at 11 million. They actually budgeted a small loss. So they have started the year with a pretty healthy gain, 11.5 million ahead of their budget for the first quarter. Any questions? I do see a hand. Yep.
Pam, I have a question, but it's directed toward Ileana, or if you want to answer this on slide 4.
About the primary care?
Yes, ma'am.
Ileana, if you're on, do you want to speak to that?
I don't believe she's present.
Oh.
It's real. I can speak to it. We've had some primary care positions depart, and we have some positions that we're working to fill. We're also looking to expand and bring in additional and further use and bring in additional physician assistants and advanced practice registered nurses. And that's underway right now, including some of the recruitment. We hope that oftentimes we'll see a surge of individuals who are scheduled to join us in June after the residency program is complete. So we're really trying to have a good summer month and working to get those offers and bring in some additional primary care providers, as well as to continue to better utilize our extenders in both PA and AP to make sure that we're moving forward on creating additional access in the primary care side.
Great. Okay. Thanks, Ezra. So we're targeting August then, when the new residents and new physician crop of physicians come out then.
We're hoping to, and we still may be a little bit behind, but we're doing everything we can to try to make up for it. But yes, we're hoping for a good end of summer, early fall. But we're going to do everything we can to try to bring.
Great. Any other questions? All right. Thanks, Pam. Before we get to the combined motion, I believe Dr. Peters is going to give us an update. We talked earlier about the VIA contract, but I believe she's give us a more full update on VIA for contract management and nurse registry services.
Good morning, Chair Ryder and the Board of Directors. In this update, we'll go over the contract scope, contract implementation, benefits from VIA, and agency utilization, as well as some of the challenges related to agency recruitment, as well as the CCH staff. Also, Charles will go over the county recognized MBE, WBE usage. Next slide, please. So via contract was implemented in 2022 to bring in multiple contracts together under one umbrella to really support the operational services to provide safe quality care. And also this particular contract labor management services to support the nursing to cover the vacancies and also unanticipated patient care needs of the system. Next slide, please. So as just said, previous to or prior to 2020, we had 6 contracts to support the nursing needs or a patient care needs across. And also we had a 30% fill rate when the previous contracts were only able to fill in 30%. Now with the new VIA contract, formerly known as CCH, we are able to get up to 96% fill timely. And also this decreased our the contract management process, billing process. Also during pandemic, the nursing support staff as well as RN needs increased over 400%. With this contract, we were able to onboard nurses in an expedited manner to support the needs of system. And this contract also supported us to stand up multiple vaccination centers to manage the COVID emergencies. Next slide, please. So where are we with the current state? Currently, we are using the VIA contract to cover the existing vacancies across the system, both nursing, which is RN, and the support staff. We have, currently around 834 vacant positions. This is just without benefits factors. If you add the benefits, which is their time of vacation, sick time, and other thing, is close to over 1,000 vacant positions within nursing. And we are using approximately 670 FTEs worth of agency staff and also using overtime to provide safe quality care. Next slide, please. We are also looking at nursing turnover. What are the main contributing factors? So we have the data since 2021 on nurse vacancy rate. The good news is that the Cook County Health Nursing turnover rate is way below the national rate. Average currently is 22.5, and this 2023, the Q1 CCH RN turnover rate is below 5%, which is one of the best in the country. Next slide, please. Also, if you look at it, the vacancies are generated not just factors contributing to 2023. If you look at these slides, we had more nursing RN separation compared to the onboarding and all the work that HR is doing in collaboration with nursing and also in support of multiple initiatives within HR. We are able to now our net gain, which is the number of separation and the recruitment, is coming closer to equal, with the goal of us to actually get to more hires compared to the separations. And also this separation include the retirements. So with that, let me pause. I see a couple hands. Director Harrington.
Yes, my question is regarding the prior slide. Could you go back to this one slide? Yeah, you have 20, 21, 22, 23. Is that a year-to-year comparison or a period comparison? That's my question.
Yeah, the 21 and 22 is the year comparison, and the 23 is the Q1. So when we do the calculation, we only take the Q1 data to do the same calculation. So we use the national standard metrics for the calculation.
Thank you.
We continue to hear the nursing recruitment challenges. Since COVID, there is increased nursing market data, market demand, and also significant gap. And a report came out last week from the National Association of College of Nursing, where a new study showed that almost 100,000 nurses left the bedside or left the profession during COVID. This is the new data came out last week. And that also impact our hiring velocity because there is not enough nurses out there to meet the demand. Also, many systems are having now more attractive compensation package, including travel agency demand is still high. It's not as high as during COVID, but still, especially the younger nurses are the agency travel contract due to the compensation. So I shared with the last update too. We still, national turnover rate was 27%, and it's continued to be in upper, mid 20s. So our age of the nursing workforce is near 54. That also is one of the challenge faced by systems across the country because number of these nurses will leave the bedside either due to through retirement. Also by 2024, we are projected to have a 1 million in the workforce. So all this contributes to our ability to really expedite our hiring process. Next slide.
I believe Director Robinson has a question.
Hi, Director Robinson.
Hi, I have a question for you. I'm looking at, you had a couple slides back where you gave us, yep, that's it. So here's a question for you, and I genuinely don't know this answer, but the HR is doing a fantastic job, and I think we all recognize that, to try to fill the vacancies. But the portion of retirees that are people who are retiring, here's a question. Is it reasonable or possible to, in order to reduce the dependency on the agencies, if the nurses who are retiring are allowed to retire and then be brought back in maybe a part-time position, so that we can actually fill the vacancies, we can actually have people that we know are competent, and also increase the morale of the current nurses to be able to fill those voids. I don't know if that's just a thought I had here while looking at your presentation.
No, thank you, Dr. Robinson. Actually, that is one of the national best practices. This is something, working with the our system. It's beyond our HR system. Currently, the Cook County, the rules and regulation will not allow the retired nurses to come back to the workforce as a part-time employees due to our retirement rules and regulations. So I did discuss this, and we are trying to see what other options we have to bring them back, because that is one of the best practice. Many health systems are bringing them, not the full-time bedside, but definitely, to support some of the experience and also support onboarding the new nurses. So we are exploring that.
So the rule prevents you from bringing back those individuals who retire from your system. What about other systems?
Other systems we can, however, other systems are bringing back their own retired nurses. So
they don't operate under the same constraint.
No, because especially the Cook County, this is where maybe I need some help here.
If I can,
if you understand, Cook County Pension Board will not allow us to bring back the retired staff to part-time work. Yes.
Vina, can we have, I think Val wants to.
Yes, thank you, Val.
This primarily has to do with the structure of our public pension and the rules allowed under the pension system to allow retirees to return to positions that they are pensioned under. But Val, maybe you can give some more clarity.
Thank you, Chair Ryder. I won't speak as an expert on the pension program, but I will say, Director Robinson, we have actually explored bringing back retirees in another area. It was respiratory, and so individuals who had previously retired and were interested in returning back, we asked them to consult the pension board to ensure that they were able to do so and to provide hours. Let us explore this a little bit further, because I know that there are some regulatory standards associated with it. I don't profess to be the expert today. However, we want to explore all creative opportunities so that we can attract and bring back individuals who are experienced at our CCH organization. So I'll defer to Israel as well if he has more to expound on. Thank you.
And I want to manage expectations on this. This may be something that is statutory in nature in terms of how the public pension rules work, and for our system and for the county pension and other pensions. So
Correct, Chair Ryder. Yeah, no, I was just going to add it is I guess what you can say why we're a little bit different than most systems is that we're one of the few health systems that still offers a pension benefit to our employees. And that's where some of the differences, you said other systems don't and we don't. I don't know all the explanations for it, but I can say the complicating factor is the benefit. And we do offer pensions. And because there are some rules on how you earn that pension based on your time and employment, there's some workaround that could be done. It would require some statutory language. What we can do is we have been working on this and looking at it quite a bit. As Bina said, it's a best practice and we are eager to see what we can do. But it is something that would require some statutory relief. And so our legislative and legal team have been working. What we can do is we can have some of that prepared for briefing and discussion in the upcoming meeting. And we'll work with Chair Ryder to schedule an update just on what that could look like. But we want to make sure we have the right elements in place. So we'll put that as a presentation to be delivered, and we'll work with Chair Ryder when that's ready. But as he said, it is a complicated factor, not anything we can do locally, because we operate a specific way with our pension plan that's not only just ours, but extends to the county. And we need to make sure that we are doing everything appropriately on that side. So we will make sure to get some information and bring back some information to the Finance Committee on that. It is something we would love to do. But as we said, we have a special gift that we get to do a benefit, and that unfortunately creates a little bit of complications when you're trying to bring back rehires. But doesn't say it's impossible, just might take some work, and we can lay out what those steps would be.
No, but I do want to say it might be incredible, depending on where the rule exists. It could be incredibly difficult because this is a matter of public policy, pensions and benefits, and there's many people in the industry that would say that we can do this, because other systems bring back the retirees who either maybe under a private sector pension or under, a defined contribution plan. There will also be, a public policy question over whether someone who's collecting a benefit as a retiree, a defined benefit under as a retiree for their pension, should also be then collecting a salary as an employee under the same system that they're retired under. And more than likely, this is not a rule that the Cook County Pension Board can control. It is something that would take an act of the Illinois legislature and would potentially impact, would have to be a rule that would have to be changed for everyone under Cook County, under the Cook County plan, not just for the hospital system as a carve out. So, like I said, just to manage expectations.
Said it perfect.
Okay.
You said it perfectly, Chair Ryder. It would require.
All right.
So quickly, we also look at the market salary. The VIA help us to look at the market analysis of the nursing hourly rate, and we adjust those rate bi-weekly or on a monthly basis. So make sure that we are appropriately adjusting our nursing agency dollars. Next slide, please. So based on the current market trend, this is the slide from Vias market analysis on our existing agency utilization. We are projected to decrease over $2.2 million in our total expenditure due to rate adjustments. So this is the good news. So we are looking at on a ongoing basis to make sure that the total expenditure is meeting the market demand. Next slide. With that, let me turn this to Mr. Jones to provide the MBWB update.
Thank you, Dr. Peters. So on this slide, you see with the VIA vendor pool for CCH, we have a pool now of over 50 vendors. Those highlighted in yellow are county certified, City of Chicago or Cook County certified diverse vendors: Advanced Care Services, Inc., Corsair LLC, PNI Professional Nursing, Inc., and the Nurse Agency, those four. However, I do want to highlight that FIRE has 5 other diverse vendors that do provide resources to us. Unfortunately, we cannot get credit for that because they're not certified, but 24/7 Med Staff is a certified minority vendor. Aura Staffing Partners, One Staff Medical LLC, Total Med Staffing Inc. here, and then VTech Solutions Inc. is also 5 other vendors. So a total of 9 diverse vendors providing resources to CCH. Again, the hours that I'll show you next will be on the 4 that are certified by the county. Next slide, Debbie. Okay, so for the diverse suppliers hours, we have 6 reporting periods here since the inception of the contract. Where you see that the hours have been trending up each consecutive period. I want to highlight here for the first 4 periods, the reporting period was 5 months, and the last 2 periods here for August 2022 to October 22, and November 22 to January 23. They've now started reporting out on a quarterly basis every 3 months. So whereas it seems here with 18,497 and 18,518 that we're trending down, we're actually if you expand that out over the same consecutive apples to apple period of 5 months, we're holding steady at approximately 30,000 hours each quarter. Of that, for our MWBE total hours there, the last 2 quarters, these 4 vendors has provided 6.4% of the total hours done, and this last quarter, 5.4 hours of the total hours, and the other 45 vendors are providing the rest of the hours. Any questions?
This is Director Harrington. I have a question.
Yes, sir.
You talked about the minority vendors providing 6%.
Yes, of the hours.
Is that
These are
correct?
hours only. Yes.
Hours, 6% of the hours.
Yes.
Okay.
Of the hours worked.
Thank you.
For August through October and November through January, 5.4%. Any other questions?
So with that, Chair Iden, I'd like us to confirm the frequency of this update. I know in the past we talked about, we started with the quarterly update and we moved to biannual update. So just want to make sure as a team, we have consensus on the next update.
Yeah, and we want to be super clear about this because I think there's different expectations on what it was based on the fact that we changed it. That we made an adjustment, and I'm not sure that everybody had the same memory, so recollection. So what's the will of the committee? Do we want a biannual update or do we want a quarterly update? Staff is happy to do whatever as long as we know what's expected. I'm gonna start with Commissioner Deere. Dennis, what do you want? Do we have someone with their hands up? I'm not seeing Dennis. Joe?
Yeah, I think biannual right now is fine. I don't know if there's going to be any dramatic change in 3 months. And so biannual right now, if there was a dramatic change and things, then perhaps we would want to know. But unless there's something dramatic that happens between now and October, I don't think there's any reason for them to come back and update us.
Okay. Does anyone disagree with that?
Sorry, Mr. Chair, I had stepped away for a second.
That's all right.
Can I speak at this point?
Yes.
So my vote would be to continue quarterly. Biannual sounds good, but my concern is when we do stuff biannually, it's so much information that comes through these boards and committees that it gets lost. And so biannually, stuff gets lost. We forget to check on it. You know, we forget to swing back around for accountability. And let me just speak for myself. It creates a stumbling block for me because it's so much information that we are being asked to digest in these particular meetings. And so I would ask that we continue to move forward quarterly.
Okay. Well, I think that doing it more frequently doesn't provide any harm. Joe's comment was we could do it biannually, but Joe, I don't think you would object to more frequently if someone wanted it, correct?
No, I wouldn't object. And I did say that unless there was some dramatic change, I'm assuming that you're monitoring this on an ongoing basis. If there's a dramatic change, I think we would love to know that things are trending in the right direction.
Right. Okay. So why don't we go with quarterly for the time being, and then maybe there'll be a dramatic change that would have us decide to back it down to biannually. All right.
I appreciate you.
Bina, does that work for you?
Yes, thank you, Chair.
Thank you. All right. I think that unless there are any other questions on any of that, we're going to move now to the combined motion, which would be a motion to accept item 3A, the March 23rd, 2023 Finance Committee meeting minutes, approve item 4A, contracts and procurement items containing request number 1 through 47, subject to completion of review by contract compliance, and receive and file item 5A, the grant award related items. Is there a motion?
So moved, Director Harrington.
A motion's been made. Is there a second?
Second, Commissioner Deere.
Motion's been made and seconded. Any discussion on the motion? Hearing none, will the secretary please call the roll?
Roll call vote on the combined motion. Aye or nay? Director Deere?
Deere is aye.
Director Harrington?
Aye.
Director Robinson?
Aye.
Director Story?
Aye.
And Chair Ryder?
Aye.
You have 5 yeas and 0 nays.
All right, great. Debbie, when's our next meeting?
Our next meeting is on Thursday, May 18th. And for the record, I apologize, I should have said this earlier in the meeting. Director Sorrell has been with us since near the beginning of the meeting.
Oh, thank you, Debbie. Apologies for myself not picking up on that either. And I can't believe from the beginning to the end of the meeting, I forgot that the next meeting is on my daughter's birthday. My gosh. Anyway, we have exhausted the agenda, so the meeting's adjourned. Thank you.